Good afternoon. I'm Yaron Perry. I'm the Chief of Division of Thoracic Surgery and the Co-Director of Robotic Surgery, as well as the Director of Comprehensive Center of Thoracic Malignancy within the Kaleida Health System. Today, I want to talk about lung cancer and the effect of smoking and vaping, which related to it. What is lung cancer? Lung cancer is uncontrolled growth of abnormal cells in the lung, and it's the leading cause of cancer worldwide. It's also the leading cause for death, for cancer-related death worldwide. Lung cancer divided into main two types. One is small cell and the non-small cell. Most of the cancer we see are the non-small cell type, more than 85%. And it happens that a normal cell in the lung, as you can see here, is exposed to certain chemicals, certain environment agents, and it turns into a precancerous cells, and eventually propagate and grow and fill the lung and become invasive cancer, which then metastasis and ultimately kill the patient. A little bit statistics, 1 in 16 people will be diagnosed with lung cancer in their lifetime. Last year, about 250,000 new cases in the US, half of them are men, half of them are women, and the death from that is 127,000 deaths happened from lung cancer last year. It accounts for 14% of all cancers and 30% of all cancer deaths. Just to get it perspectives, the people in the US who died from COVID, about 232,000 people died from COVID, and this is for the whole years of COVID. I'm talking about annual death of about 127,000 people. More statistics. Black men are about 12% more likely to develop lung cancer than white men. The rate is about 60% lower in black women than in white women. And overall, women have lower rates of lung cancer than men, but the gap is closing, and we'll talk about it soon. Lung cancer rate has been dropping among men, but over the past decade, maybe because of the change of the lifestyle, it's actually increasing in women. If we look about the lung cancer death, I know people are not aware of it, but lung cancer death is larger than if you take the death toll from breast cancer, prostate cancer, and colon cancer together. What are the symptoms of lung cancer? Well, the most common is persistent cough and chest pain, shortness of breath, people cough blood. But actually today, because of the people get imaging everywhere they go, if they go to the emergency room, if they're admitted to the hospital, the most common is to find it as a nodule in the x-rays and no symptoms whatsoever. Patient has no symptoms. And why is that? Because when it's very small and it's early stage, like a size of a pea, it's still early and it can be cured. But if you still look on the statistics, only 92% have a 5-year survival, meaning 8% potentially will die from lung cancer. When it grows just a little bit more to the size of a peanut, the mortality is higher. About 20% will not live 5 years on average. And when it's the size of a dime, which is, between 2 to 3 centimeters, it's very small, a quarter of these patients will die from advanced lung cancer. As well as when it goes even to a larger, of course, it goes, as you can see at the diagram on the right, the survival rate is going significantly down. So what do? We have to screen patients for lung cancer. Who do we screen? Well, we take adults with the age of 50 to 80 who have about 20 pack years. Pack years means if you smoke a pack of cigarettes a day for 10 years, it's at 10 pack years. If you smoke 2 packs a day for 10 years, it's 20 pack years. If you smoke 1 pack a day for 20 years, that's what we say 20 pack years smoking history. And if you are a current smoker, you're actively smoker, or you quit within the last 15 years, you're eligible to get CT scan screening. Your primary care or your pulmonologist should send you for CT scan screening. It's covered by CMS, by the Blues in New York State, by the Blue Cross Blue Shields, by Medicare, by Medicaid. And you should have a CT scan, which is a very simple procedure. You basically go, it's not painful. You don't have to get any contrast or any injections. You go into the CAT scan, they scan your chest. It takes a few minutes and you go home. And then if they find any nodules that you can see in the diagram here, and there's a CAT scan that shows a small nodule in the lung, which cannot be seen on a regular chest X-ray, does not give any symptoms. It's really concerning. It has to be checked, diagnosed, and removed. And when you do that, when you diagnose this early, it saves life. So the best way to cure lung cancer is finding it early. And the way to find it early, to have screening. How do we get tissue from that? How do we know it's lung cancer? We have a very sophisticated equipment and a very innovative with AI and navigation bronchoscopy, which is a tube that goes through the air pipe, as you can see on the left. Patients go into general anesthesia or go to just partial anesthesia, and they go in and biopsy the nodule, which is very accurate. It goes into a computerized system, a navigation system. We sample those, and some of those nodules also can be sampled via regular CT scan or ultrasound, where the needle go from the skin. They numb the skin if it's very close to the edge of the chest, and they take a biopsy from the nodule, and then we have a tissue to identify if it's yes or no cancer. And again, we also can get ultrasound probe, and you can see in the diagram down, that's how it looks like, this navigation system. We have here in our system robotic bronchoscopy, and this has been done by our interventional pulmonologist. And you come and go, have this biopsy, and go home. If we find cancer, we have the highest technology, the up-to-date robotic surgery, which we operate on our patients to remove the lung cancer. We usually remove the cancer with the surrounding tissue around. Sometimes we do a lobectomy, which is a whole anatomical resection of the part of the lung. We have 5 lobes in the lung. We have 3 on the right, 2 on the left. And occasionally, if patients are smokers and they don't have good lung function, we take part of it, but we sample the lymph nodes and we make sure it didn't spread anywhere. This is a very extensive surgery, although it's done with very small incision. As you can see in the right corner, we usually have between 4 to 5 tiny 8mm incision. And through all these 5 little ports, as you can see on the left, the robot is being mounted on it, and we dissect to the deep in the chest, remove this area with the lung cancer, and the patient usually has a minimal incisions and can go home within 2 to 3 days with no any sequela, especially if his lung function is adequate. What caused lung cancer? You know, everybody has a friend that is a smoker and never had cancer, or never smoked or had cancer, but I can tell you 90 to 95% of my patients are smokers. And the cigarette smoke has a chemical composition basically has a carcinogen. These are chemicals that cause cancer, proven to cause cancer, like tar, like benzenes, like formaldehyde. We have the nicotine itself is caused the addiction, but the things that around it are causing the cancer. Usually it's dose dependent, as I told you. The more you smoke, the more the risk is to have lung cancer. So if you smoke 2 packs a day, your risk is much higher than someone who smokes only 1. Still, also, if you smoke for 10 years or smoke for 20 years, 20 years give you a higher risk for cancer, and it doesn't come immediately, usually come within 5 to 10 years after your last cigarettes. Why we have the smoke so prevalent? Because it started as a social habit. In the 50s, believe it or not, even physicians were marketing cigarettes, which looks crazy nowadays. But you can see these are advertisements from the 50s about how cigarettes are actually good for you, and with a filter, without a filter. But in the 60s, the Surgeon General find that actually it does cause cancer. It causes other medical problem like emphysema, COPD, a lot of respiratory problem, and cigarette smoke is bad. But there's a huge industry around it. You can see that cigarettes bring huge revenue, about $12.4 billion a year. And you can see that it's mainly cigarettes, but there are new products, and they're expected to rise, as you can see, to 2025, 2026, 2027, and forth, if we're not going to do anything. And especially the rise in the use of what we call water pipes, vaping, and things which are in other smokeless tobacco, which are not cigarettes, which is really alarming. Why it's alarming? Because let's talk about vaping. So initially, they developed the electric cigarettes as an alternative to smoking. And Unfortunately, it became very popular in the young population. Some young people that never smoked, but now not only they have a gateway to smoking, but now they're using this product extensively. And let's look at what the composition of electric cigarettes. If you look at what the vapors contain, it contains nicotine. It's actually the flavoring and the solvents are actually propylene glycol, it's glycerin. You should not have glycerin in your lungs. I mean, you can put it on your skin, but not on your lungs. And this presence is really harmful. These are the formaldehyde, and the acrolein is really harmful to the lung and cause damage. It's basically, there is increased link to lung cancer, and long-term effects are still, we don't know about it because it's only prevalence in the last few years. We know that it's including inflammation. It causes almost like the infection without the bugs in the lung. Almost you feel like pneumonia and other breathing issues. And it's really, these chemicals are potentially high risk for cancer. Unfortunately, more than 2.1 million teenagers are currently vape. I mean, it's horrendous. And we do see it as a physician, as thoracic surgeons, as pulmonologists. We see these injuries. Just in the last a couple of years, there is a 57 deaths in 27 states of young people from vaping. The youngest was 15 years old. We actually had a total of more than 2,600 people hospitalized for lung injury, totally related to vaping. So for summary, lung cancer is a serious disease, and it's preventable by basically stop smoking and obviously stop vaping. We have to educate ourselves, educate our kids about the risks, and we have to take any steps for smoking cessation and avoid vaping. Low-dose CT scan screening is associated with early diagnosis, early stage lung cancer, and cure. It does work. Because when you have a small and early stage lung cancer, we can manage it by surgery and local treatment when feasible. Vaping, we know it's injured the lung, it can cause death and may cause lung cancer as well. Thank you for joining us today for the HealthyU. Hope to see you next time.